Comments from the mayor and governor. And Mayor
And
Abbott is
there's
coming out with his mask on
there's the
along with
governor.
other officials. So let's take a listen as this press conference gets underway.
You guys all set? Everybody else all set? Good to go. Okay. Well, listen, it's an honor to be back in Amarillo. I'm honored to join together with Mayor Ginger Nelson, as well as my colleagues in the Texas Capitol, Senator Seliger, Representatives For Price, Representative Smithy, as well as Representative Ken King. The reason I'm in Amarillo today is because Amarillo is an example of how Texas is going about the process of responding to COVID-19 at this particular stage of COVID-19's life in Texas. What happens is that we had the first month or two of challenges with regard to COVID-19 in March and April that required us to get a feel for how the virus was going to be spreading in the state of Texas and be able to amass all of the PPE, the medical equipment, the testing that were needed in order for the state of Texas to be able to assist local communities in responding to COVID-19. Now that we have gone through that initial stage, we are now at the level where we are opening up the state of Texas economically. And it's important that we be able to open up while maintaining the safety and lives of our fellow Texans. And there is a strategy that we use to go about that process. And that strategy involves what we call surge response teams. What surge response teams do is they identify hotspots in Texas where there is an increase in the number of people who are testing positive. What we have found is that those hotspots typically relate to three different categories. One is an increase in people testing positive in nursing homes. Another is an increase in those testing positive in meat packing plants. And a third is those testing positive in jails or prisons. Amarillo has gone through the challenge of facing all three of those hotspots overlapping. Nursing homes, several nursing homes, a jail, and then, of course, dealing with the consequences of meatpacking plants. That led to an increase in the number of people testing positive in this region. And that led to concerns on our part about making sure that Amarillo was going to be able to have everything that it needed. And when I say Amarillo, I'm talking about Randall and Potter County, as well as all of the surrounding counties. We wanted to make sure they had everything they needed. And so the mayor and I had a phone conversation, and that led to a conversation that I had with the vice president, where I explained the challenges that existed on the ground in the Amarillo region to the vice president. And the vice president just immediately said, okay, here's what we will send, and included CDC team, and included more testing supplies, it included other additional types of supplies to make sure that we would be able to robustly respond to the challenges on the ground in the greater Amarillo area. And the results are astounding. The results are on this graph over here, but I want to walk you through what has happened in the Amarillo area. Going back to, you can see on May the 13th, at that time there had been a total, let me first explain what this graph shows. This graph is the aggregation of data for Potter and Randall counties. So every number you see for all of these different information segments for both Potter and Randall counties. So for Potter and Randall County, on May the 13th, there had been a total of 5,674 people who had been tested in the region. and we had to cut it off effective yesterday or on the 25th. And so from May the 13th until May the 25th, they almost doubled the number of people who had been tested in Potter and Randall counties. And then you can see the new positive cases, the people who tested positive. It was 182 on the 13th. It spiked up to 734 on May the 16th. And then you could see a slow trickle down until you got to May 25th, where you had 0 people test positive. And if I recall correctly, the same was true yesterday, where I think there were 0 who tested positive yesterday. This is exactly what we have seen when we have deployed these surge response teams to the other hotspot areas like this. You see an early spike in the number of people testing positive, and then you see a slow decline in those testing positive that demonstrates that the hotspot area has been contained. One thing particularly good in this particular case in Amarillo, you did see an unfortunate increase in daily fatalities on May the 14th, but after that, the fatality rate has been extremely low. And then we look at hospitalizations, and the important thing there is even with the increase, in fact, in a way, a sudden and substantial increase in the number of people who tested positive just a few days earlier, there was no dramatic increase in the hospitalizations in Potter and Randall counties. They stayed relatively flat from May the 17th all the way to May 23rd. On May the 17th, obviously, it was 24, and on May 25th, it was 23 people who were hospitalized for COVID-19 related issues. And so if you look at the key metrics of what we look at on a statewide basis to see how a particular region is responding and to see whether or not a particular region is challenged in dealing with COVID-19, you see the reason why there was a need to have a surge response team to assist this region respond to the challenge. But also you see extremely positive results that lead to the ability to say that Amarillo has turned the corner on its pathway toward a positive, effective resolution of this particular hotspot. Now, one thing that this does, this makes Amarillo and the region of the Panhandle be a part of the process of allowing Texas to open up our economy. While so many people in the state are suffering from the coronavirus, there are so many more people in the state who are suffering economically. Their businesses are being shuttered, their paychecks are being lost, their ability to feed their families is being compromised, and they need help. They need to get back to work. You know, one thing about Texans is they're not looking for a handout. They're looking to get back to work. And so part of our collective responsibility is to create a structure where we can enable Texans to be able to get back to work while coexisting with COVID-19. As we are in this transition period from where we are today until we get to that moment in time just a few months from now, when there will be medications available to treat people who do test positive for COVID-19. Now, at the Texas level, we're seeing similarly positive numbers come out over the past few days. We have a 2-day ongoing average of testing. We continue to test more than 20,000 people a day across the state of Texas. The positivity rate, which is a rate that we look to as one of our yardsticks that determine how well the state of Texas is responding to the spread of the coronavirus. The positivity rate remains low. The 7-day positivity rate is 5.25%. Let's go back in time to the middle part of April. The positivity rate at that time was 13%, then 11%, then 10%, then 9%, making its way all the way down to 5%. And so with a positivity rate, which is the rate of the percentage of all the people who were tested who test positive, with a positivity rate of only about 5%. As the White House Coronavirus Strike Force has said, that is an acceptable positivity rate to show that the state has adequately contained the spread of COVID-19. Also, incredibly importantly, yesterday and the day before, and the day before that, we had 3 days in a row that had the lowest 3-day numbers of deaths in the state of Texas since the end of March. And so the fatality rate in the state of Texas, which has always been one of the lowest in the United States, continue to be extremely low. And that also shows that Texas has taken a positive turn in our battle against COVID-19. Similarly is the hospital rate. Go back 2 days ago, and we had one of the lowest hospitalization numbers in the state of Texas since the middle part of April. Percentage-wise, if you want to do it mathematically as a rate, when you consider the number of people who test positive for COVID-19 and the hospitalizations as a result of it, the hospitalization rate is one of the lowest since the beginning of COVID-19 expanding in the state of Texas. So all the numbers are looking good. I do, however, want to provide you one cautionary note. As many of you may know, there has been an extreme addition to the number of tests that have been conducted at the JBS facility nearby. Because of the massive increase in the number of tests and because it is considered to be a hot zone, you can expect in the short run, meaning later on this week, that there will be what should be one last spike in the number of people testing positive and correlated one last spike in the positivity rate. So that is to be expected. We will not be surprised. In fact, I would be surprised if we did not see that spike. But what I expect is after that spike, you will continue to see an ongoing downward trend in those testing positive in this region. And you will see this region having contained COVID-19. And so I'm proud of the leadership in the entire region, all of the counties around here, all of the healthcare providers around here, and of course the leadership of Potter and Randall County and the fabulous mayor of Amarillo, Ginger Nelson. So at this time I'd like to pass it off to Mayor Ginger Nelson.
Thank you, Governor. Well, I would echo that, how much we appreciate your leadership. It is true, and I'll tell my grandkids the story someday, that I sent the governor a letter on Wednesday, and within an hour I was on a phone call with Chief Kidd, and by Friday I was having phone calls with you personally, and next thing I know, both the state government and the federal government are sending strike forces to our city to work on this problem. So if that doesn't make you proud to be an American and proud to be a Texan, then I don't know what does, because we needed help, we asked for help, and help came. And as you said, we're beginning to see the results of that partnership play out in our numbers. And what's numbers on a page are people in our hearts here in our community. So on behalf of the people of our community, I want to tell you thank you. Thank you for your leadership, and Chief Kidd, thank you for your efforts on the ground here in addressing the problem that we had in the hot spots that we had. We have needs going forward, and we're going to continue to work on those. You know, this has brought forward the idea that we need more internet coverage here in the Panhandle. Just watching our kids go inside for education and watching people try to do telemedicine in rural areas. So that's something we want to start to work on and continue to work on it and expanding the internet access that we have here in the Panhandle. We want to watch for economic development opportunities. Yes, we need to recover in the economy. We need to be working where we can be working, so we appreciate that you're opening our state, Governor, but we want to watch for economic development opportunities that could partner well with our Texas Tech Vet School, perhaps, you know, pharmaceutical manufacturing and all the jobs we can bring to Texas. We want to help you do that. So we're excited about being out of this situation, but we recognize that we have challenges yet to be faced. So thank you for the partnership that you brought. We're thankful for the local partners that were involved in this too. It's been boots on the ground for sure. I want to commend the city staff under the leadership of our city manager, Jared Milton, but also Casey Stoughton and Dr. Scott Milton, who have led us in this effort. We've had many community partners. Tyson has been a good community partner. They've made hard decisions, and I believe we as a community are going to see the benefit of those hard decisions. Even Texas Cattle Feeders Association and some of these folks who were on the ground trying to help us approach this problem. I appreciate the leadership of Ross Wilson. I appreciate the leadership of Mark Bivens, who served on the governor's statewide task force. Has been a large partnership, and a lot of people have put their hand to the plow in order to work on this situation in Amarillo. To see the results, and I hope that Governor, next time you come back to visit us, we're putting you down for a steak dinner and a more extended stay. We won't have to talk about all this hotspot situation. So thank you for being here, Governor. We really appreciate you.
Thank you. Now I would like to introduce the person who spearheads our team that leads these surge response teams, as well as manages the state operations. He is the chief of the Texas Division of Emergency Medicine. His name is Chief Nimkit.
Thank you, Governor. I want to quickly thank all of the state agencies that have been as part of the support of the mayor and her team and the judges that have been here with us. The Texas Military Department's done a tremendous asset. Over 212 personnel surged into the area. 130 of those are still here now and will be here until the mayor and her team decide that it's time for them to be released. But we've also had the Texas Forest Service, the Engineering Extension Service, AgriLife, the Department of Public Safety, Parks and Wildlife, the Department of State Health Services, Health and Human Services Commission, the Emergency Medical Task Force, and some of our private sector partners like BCFS. As you can see, it's the strike force and the surge team, the governor's directive. It's a whole approach. It does take a team to get this done. Amarillo has been the place where we launched it first, and we've seen great success. It's the model that we're pushing in other parts of the state as well. You don't hear as much about personal protective equipment demands anymore, although we're still hearing some, but that's because the surge model has helped build this out. You will continue to hear less and less, I think, about testing. As we get more people tested, more prevalence to a test. Today, there's over 600 locations across the state of Texas that you can go and get a COVID-19 test. They're on our website. You can get them at texas.gov, and we encourage people to keep going to those sites if they're sick or if they think they need a test. And as the testing capabilities expand, so too will our understanding of this. Very proud of the work done here at the local level and our healthcare providers and first responders. Hats off to the fire department and EMS around here as well. Great job in supporting their community. Thank you.
Thank you, Dan.
Great. Good afternoon. My name is Casey Stoughton. I'm the Director of Public Health for the Amarillo Area Public Health District in the city of Amarillo. Before the COVID pandemic, the mission of public health was prevent, promote, protect. During the COVID pandemic, the mission of public health was to prevent, promote, and protect. And after the pandemic, the mission of public health will be to prevent, promote, and protect. I'd like to take just a minute to talk about each of those pieces of the mission related to the COVID pandemic. So we'll talk about prevention. In collaboration with the State of Texas Department of State Health Services, Amarillo Public Health has had a long-standing public health emergency preparedness grant for all hazards, including pandemics. The processes and relationships established long ago are working well now. We appreciate the teamwork and rapid response when calling in the expertise for the Centers for Disease Control and Prevention. I appreciate the great working relationship we have with Kelly Northcott, Deputy Regional Manager for this Public Health Region 1. With regard to promote, as the Vice President of the Texas Association of City and County Health Officials, I value relationships with local health directors across the state of Texas. The ability to speak quickly with the Director of the City of Houston Health Department, or ask questions of the Director of Denton County, or share resources with the City of Lubbock brings resources into each community quicker than ever. And protection, Northwest Texas Healthcare Systems and Baptist St. Anthony's Health Systems, along with community providers, are coming together with the Amarillo Public Health Department to serve our community with collaborative testing efforts, communication, and surge plans. Amarillo Public Health and Texas Tech School of Medicine are providing drive-through testing free of charge to the community and have been doing so since March 27th. That's 2 months to the day. When we were planning the drive-through testing effort, we knew that supplies would be the limiting factor. We were scouring Amazon, health supply vendors, and working with labs to maintain supplies of swabs. And when we were working on the drive-through testing, we knew that viral transport media would be an issue. So Dr. Todd Bell and I were talking about like the opportunity to make viral transport media. And so Texas Tech School of Pharmacy has made thousands of doses of viral transport media and has provided that statewide for testing. And I could not be prouder of the team at the Amarillo Public Health Department alongside our Public Health Authority, Dr. Scott Milton. There's a lot of great work still to be done, and we will hold true to that mission of prevent, promote, and protect.
Great, thank you so much. We'll be happy to take a few questions.
Governor Jackie Houston, KAY Local 4. Thanks for your time. It's nice to see you in person.
Sure, you too.
Today. I'd like to ask you about a second phase plan. I know that we were the first to send in the search team. We're all kind of building the airplane every day. What are the plans for a secondary spike, maybe later in the summer or later into the fall? And what kind of resources will be available to us here in the city of Amarillo and in the region to call upon again?
So we are prepared and preparing for second and third level expansions of COVID-19. Second level would be as we go about this opening up process. We realize there could be spikes like what we've seen in Amarillo. And so with NIMKID and his team, we're prepared to send in these surge response teams to make sure that we will be able to tamp down any type of flare-up using the model of what we've seen in Amarillo. Then there's talk about potential second flare-up or third flare-up in the fall or wintertime when the regular flu occurs and COVID-19 could occur if we don't have medicines to take care of it. So we're preparing for that in part with what Chief Kidd talked about. We have a very robust supply chain team that is aggregating masks, gowns, face guards, all the different types of PPE as we speak. Right now we continue to distribute it across the state of Texas, but because we have Texas-based manufacturers of these materials, we should have ongoing supply so that we will not be running out like we were in the original part of this process. In addition to that, we will be adding as many testing supplies as well as medicines as possible to make sure that we will be able to respond to this. The last thing I'll tell you is this. Key to our strategy is to make sure we always have sufficient number of hospital beds, ICU units, and ventilators available to make sure that no Texan will go without health care. We do not want to see in Texas what happened in New York, New Jersey, places. So we constantly monitor hospital capacity and hospital availability to make sure that we will have the beds available. Go back to one of my original orders, which was a requirement that hospitals stop non-essential surgical procedures. That could always be triggered, if necessary, to increase hospital capacity. Now it's not needed. As a result, now it's time for people who have those other healthcare needs to get those addressed. We want to make sure that people who have cancer concerns or heart concerns or other different types of concerns, they get fully addressed right now. Sure. Sure, for PPE and some other things like that. So we have leading our supply chain, the former national supply chain for Dell. And they have as part of their supply chain sources in other countries. And there have been occasions when it has been necessary early on in the process to go to other countries. Now, however, we do have adequate supply chain within the United States. One of the lessons that have been learned from dealing with this pandemic is that the United States as a country had offshored to other countries the production of PPE, the production of medicines, even the production of the plastic vials that medicines are transported in. As a result, one thing that's taken place as we speak, and one thing that will continue during the course of this year, is the onshoring or reshoring of the manufacturing of all of those supplies so that the United States will never again be dependent upon other countries for the supplies that we need for medical care in this country. Yes. Well, keeping it home, but expanding it at home. So, as you know, but let me explain, we are testing 100% of the nursing homes around the state of Texas. And that includes both the residents as well as the staff. And we have the National Guard going in working to sanitize the nursing homes. Nursing homes is one of the most vulnerable settings that we have in the state of Texas, and a setting that leads to one of the highest levels of fatality rates. And so we want to test and identify everybody in the nursing home who may test positive for COVID-19 and separate the sick from the well and make sure we're able to treat the well. And as we go through that testing process, we probably will see an increase in the number of people who test positive, as well as an increase in the positivity rate. But because we have been through this exercise before in other regions in the state of Texas, just like with regard to a meatpacking facility, with a nursing home, we expect there to be an immediate increase in those who test positive, and then an ensuing decline in that positivity test rate. Well, it depends on what you mean by group home. I'll answer this in part, and that is there are other types of group home settings. It could be state-supported living facilities. It could be other, like a psychiatric hospital type settings. And so any type of vulnerable setting like that, we are going in and doing testing. The first part of that process was all the nursing homes, and then there was another order on my part talking about the testing of these other locations also. Sure. So, key focal point that we in state-supported living facilities would be another. The Hispanic community, as you point out, has had an overrepresentation in those who test positive and those who faced some of the most serious consequences from COVID-19. As a result, we are providing resources targeting certain areas of the Hispanic community. One of those is to increase testing and testing sites in those locations that may be more predominant Hispanic, so that we can better identify exactly what the reason is, why some are testing more positive. Is it because of where they're working, or is it because of where they're living? And so we need to learn more information about this so we can better address what the reasons are with this goal in mind. We want to reduce the COVID positivity rate among Hispanic communities. Sure. I may follow up on that, but the person who will know most about that perhaps is Chief Nin Kidd.
So as it relates to the nursing homes, the goal of this is to make sure that we've separated out those that are sick, those that are not sick, and help those get well. If we see a spike in that nursing home again, we will absolutely go back in and test. Work on the same with our meatpacking plants and the partnership that we have there. Once that we know who has been sick and who is not sick, and we get them separated and identified, it's much easier for them to heal and stop the spread. If we see an indicator or a trigger, we'll absolutely be working with local public health and come back in and test again.
You know, in hindsight, the answer is yes. When you look at the numbers of where Amarillo is, the numbers played out exactly like I thought they would. And it was easy for us to anticipate this because we've been through this scenario so many times before now. And so it does look like a week is enough, even including the fact that we do anticipate a spike in those testing positive later this week. But I think Amarillo has turned the corner, and they're prepared to go to the increase opening up this Friday. Well, I can't tell you for the future. For right now, we all expect them to open up as scheduled, and we'll have to wait and see what the future with would you repeat?
The inspection of those plants and the big answer that question.
Thank you all. Thank you.
Thank you,
very
Governor.
much.
We
Sure.
appreciate you very much.
All right, everyone. Will Dupree once again here with statewide reporter Wes Rappaport as this press conference wraps up there in Amarillo as you see Governor Greg Abbott putting back on his mask. The first time we've seen him publicly wearing one there, Wes.
Yeah, that's something that we have not seen before. The reasoning that I guess that we understand from his team is that when you do these press conferences, a little bit hard to understand him. So I think for clarity purposes, that's why he has not been wearing one. But putting one on here, presumably because he's in a place that was considered a hot spot, a hot zone for quite some time. You know, you saw on that chart 700 something new cases just a few weeks ago, and now just no new cases there in the I think Monday, or Monday was the 25th.
Yeah, he said 0 cases on the 25th and 26th.
So that is I think one of the reasons why the governor wanted to make this trip was to highlight the fact that things do seem to be, from a data standpoint, improving there, or at least that seems to be the message that he is trying to send across there. You know, he said he wanted to highlight the response there in the Texas Panhandle, and as the state kind of works on containing COVID-19, that there are, of course, so many people suffering economically. He said, while so many suffer from COVID-19, there are so many more people suffering economically in the state, saying, quote, they need help. One thing that he had kind of floated loosely there is that medication should be available to treat patients a few months from now. We know that there is a huge effort to get treatment options out there soon. We know that there is a massive effort, especially in the Texas scientific community, whether that's the UT system, the Texas A&M system, the Texas Tech University system, to get vaccines that can help with this, that can get treatment plans going. But that's something that to my knowledge, I have not heard him say publicly that medication should be available to treat patients a few months from now. So something interesting to take note there, Will.
For sure. He also said that the state is preparing for a second and third level expansion of COVID-19 happening in the state. He said they're prepared to send in additional surge teams. However, they kept holding up Amarillo as a model for it because I believe they said that was the first place where one of these surge teams had been sent.
Yeah, kind of interesting. You talk about the fact that this community has faced so many challenges: the outbreaks at the meatpacking plants, the outbreaks in the nursing homes, the outbreaks in the jail population. But it seems to me that in hearing what the governor's saying is that these surge teams going into this community, going into those 4 or 5 counties, taking care of business, as it were, seems to be working, and enough so that it puts Amarillo back on track to reopen more businesses in the next 48 hours. And as long as everybody's keeping tabs on this, we know the federal government is even involved here keeping tabs on things.
Sure.
That if there should another need arise to kind of change things up a little bit, the state and the feds and the local public health officials are ready to tackle that.
Yeah, he kept repeating, he said, quote, "I think Amarillo has turned the corner." And based on the results that happened in the last 2 days, it appears so, but of course they're going to keep monitoring people there. And I believe Chief Nimkid, the director there from the Department of Emergency Management, had said that at least 130 people are still on the ground there in Amarillo assisting with coronavirus response in that community.
Yeah, that's a huge thing that folks probably shouldn't take lightly. Dedicating as many resources as they possibly can to that area, while of course being able to maintain 600 testing sites around the state,
Right.
And making sure that the other 1,190 something nursing homes also get the attention that they need. Out of that approximately 1,200. So a lot to balance there. But in all my conversations with state officials throughout this process, and you heard it there again, willing to spare no expense, willing to send as many people from any agency that's needed into these areas where they need the attention to then address the problem.
All right, Wes, we're going to let you go because I know you have a story to turn for all the stations here in Texas. So we appreciate you joining us and providing some breakdowns with many details about the response that the state is doing. You're doing an excellent job covering it, and we appreciate it.
Thanks, Will. Appreciate it.
All right, everyone. Thank you all for joining our stream. We're going to let you go now. Thank you all. Stay home, everybody. Stay safe. Stay healthy. We wish the best for you, and we'll see you back here another time.